So thank you, Jesse, and welcome everyone. It's great to see you all here this morning, enjoying each other and enjoying a good meal. And don't those two things always seem to go together? Not just in American culture, but in just about every culture. Food brings people together. Food is another friend at the table. Food gives us nourishment. It gives us life. And our relationship with food begins the moment we are born. And over a lifetime, what a complicated relationship it can be. I'll bet that almost every person in this room has paid special attention to their diet at some point in their lives, right? Do you know how many nutrition books you can find on Amazon? Nearly 68,000. We've got the paleo diet and the Mediterranean diet and the eat for your type diet and the eat for your metabolism diet and the 8-hour diet and the 17-day diet. And we've even got the virgin diet and the hormone diet, I guess for whether you're 16 or 60. But as confusing as all of this nutritional information overload might be, the fact is that what we eat affects how long we live and how healthy our lives will be. But when you're living with kidney disease or at risk for kidney disease because of high blood pressure, diabetes, or genetic kidney disease, your nutritional choices are even more than simply important. They are life and death decisions each and every day. You see, the kidneys are the chemists of your body. When they're functioning properly, all the vitamins and minerals and proteins and nutrients that you take in through food are kept in just the right balance. The kidney is the laboratory guy of your body who says, you've eaten too much of this, I need to get rid of the extra, or your body has too little of that, I better hold on to the scarce amount I've got for a while. And your kidneys perform this function constantly, 24 hours a day. But when your kidneys are not working, your body's chemist has retired. And if some of those things your kidneys normally modulate are out of balance, even by a little bit, you could become very ill and even die. Dialysis, the treatment that Northwest Kidney Centers provides to 8 out of 10 people in this region with kidney failure, dialysis prevents that from happening. But even with expert dialysis treatments that we provide, 230,000 treatments a year, dialysis alone cannot extend and enrich the lives of people who need kidney care. It takes more. So think of the kidney care as a three-legged stool. Treatment through dialysis or a transplant, that's one leg. Another is the pills you take to keep your body chemistry in balance and to manage other conditions that often accompany kidney disease. And the third leg is nutrition, the vital attention to the foods we eat. So dialysis, medications, and nutrition. These are the three essential legs of the stool that keep so many people alive and thriving despite chronic kidney disease. So let's say you have a transplant, a kidney transplant, or you're on dialysis, and add into your body the multitude of medications that you take to control high blood pressure or to manage diabetes, or to keep your phosphorus and potassium levels down, or to prevent the rejection of a transplanted kidney. And then the role of good nutrition becomes even more critical to ensure that the treatment you receive and the medicines that you take and the food that you eat all work together to mutual benefit. So that's why the 16 registered dietitians at Northwest Kidney Centers are dedicated to making sure that all of our patients have support and information they need. So they eat not only what keeps them healthy and alive, but also the unique likes and dislikes and cultural considerations for patients who come from 80 different countries. Now, let me give you an example. It's really important for people on dialysis to eat protein. And when one of our patients, Hagos, who's from East Africa, asked for help in doing his shopping at an Ethiopian grocery store, our head dietitian, Katie Wilkins, went along to check it out to make sure the foods would fit her patient's kidney care needs. Now, in Ethiopia, it's the cultural norm to know specifically which animal your food comes from. You want to see it, the whole animal. So Katie visited the store and found that the refrigerated meat locker contained the carcasses that shoppers could look at and choose the ribs and hindquarters and other parts of the animal. Now, we've been raised in the United States. We can't imagine that. But it was essential to Hagos. His protein needs depended on it. And he explained to Katie, if I go to Safeway or QFC and I see meat in a little white tray, how do I know where it came from? So Haggis may not have even bought any of that essential meat protein if we were not able to guide him and help him address his cultural needs along with his nutritional needs. And now we know how to help our other East African patients find the protein they need. All patients at Northwest Kidney Centers receive this kind of individual attention, and that's one reason we're unique. We know that each one of our 1,500 patients must feel empowered to make smart choices that fit their unique tastes and lifestyles and cultures. So we offer them a buffet of choices, and choice, freedom, and control are all part of living a fulfilling life with kidney disease. We offer dozens of classes, such as eating well, living well, cooking bacon the healthy way, and simple meals when cooking for one. We provide individual medical nutritional therapy for pre-dialysis and transplant patients because people living with kidney disease have special dietary needs wherever they are in their kidney journey. And with the support of your donations, all of our printed nutritional materials are easy to read and state-of-the-art, so everyone can grasp what they need to know quickly. And if one of our patients has to go into the hospital or into a rehab center or nursing home, we work in collaboration with those institutions' professional staff to coordinate care. And we share with them our specialized knowledge about nutrition because we live and breathe this subject every day and because they value our expertise. We educate physicians and nurses and other healthcare professionals so they can learn even more about the impact of nutrition on treating and preventing kidney disease. Helping our patients achieve great results is what we do best as a nonprofit healthcare organization. We succeed on behalf of our patients thanks to our 570 staff members who work with 60 kidney care physicians and work in our 15 dialysis centers. Everything we do is focused on helping people with kidney disease live longer, better lives, from in-center dialysis care to home dialysis, from our full-service specialty pharmacy, the very first in the nation specializing in services for transplant and dialysis patients, to our fitness and nutrition programs and our community outreach programs. Also, essential to our goal of improving care, treatment, and ultimately finding a cure for kidney disease is our 5-year-old Kidney Research Institute, a collaboration with UW-Medicine, where some of the most important discoveries in kidney care are being made today. Now, since we were together at last year's breakfast during our 50th anniversary year, generous private donors funded the development of the nation's finest kidney resource center on First Hill at our Broadway facility, home to patient care, 10 classrooms for physician staff and patient education, leading-edge research, and a museum showcasing 50 years of dialysis history all in one building. This incredible one-of-a-kind Kidney Resource Center is a testament to what this community can do, what you made possible through your donation support. Come by later this morning and tour the museum. I'm going to be there from 10 o'clock onward, and I welcome you to join me. In the unique demonstration kitchen at the Broadway Kidney Center, as well as at health fairs like our Kidney Health Fest for African American families, we help people address the risks of kidney disease. People of certain ethnic groups and races, along with those with high blood pressure and diabetes, are at greater risk. But each and every one of us has the potential to fall victim to kidney disease because, wait for it, because we don't pay close enough attention to our nutrition. What we eat or don't eat has a direct correlation to raising our blood pressure and contributing to weight gain. And those two things, high blood pressure and obesity, which can lead to adult-onset diabetes, are terribly hard on our kidneys. Now, remember all those confusing diet books? Well, here's one piece of advice that's crystal clear. Eat less salt, and you'll do your kidneys a huge favor because sodium raises your blood pressure. And sodium is rampant in the American diet. I'm not just talking about the salt shaker on your dining room table, although you can certainly put that away and never miss it. Sodium is added to a huge number of foods to keep them from spoiling and to make bad food taste better. It's true. Between 70 to 90% of the salt you eat has been added to your food by someone else. All those microwavable snacks and dinners, they're loaded with sodium. Canned soups and stews and chili, absolutely full of it. low-fat foods. Many are high in sodium to try to make up for the flavor they lose from fat. And the packaged Hot Pockets and Lunchables that you eat at your desk, super high in sodium. In fact, if you ate a Lunchable, those seemingly healthy packages of cheese and crackers and lunch meat and fruit, if you ate one of those every day for 6 months at work, here's how much salt you would consume. It's a hidden and dangerous source of way too much sodium. Even the food you think is good for you, that wholesome wheat bread from the grocery store, bread's the #1 food on our loaded with sodium list. So our keynote speaker this morning, Mark Bittman, can tell you about good food. He can also, by the way, tell you how to cook everything, which is the name of his terrific cookbook, which has been very well used in my kitchen for years. I've learned many lessons about nutrition from working at Northwest Kidney Centers. And I'm enormously proud of what we're doing for the community when it comes to nutrition and health education. I'm also very proud that when someone with kidney disease in our community walks through our doors in need of kidney care, they receive it, whether they can afford to pay for it or not, thanks to the charity care we provide to make sure the costs are covered. And here's something else that's really exciting about all of this good news. You are responsible for much of it. Your gifts make it possible for us to provide that charity care for people in need, along with the nutrition classes and educational materials and community outreach and training for health professionals and collaboration with hospital partners and much, much more. Thanks to the generosity of people like you, that three-legged stool of treatment, medications, and nutrition stands firmly upright. And today, your support for these services is even more critical than ever. We must rely heavily on government funding to help us care for people with kidney disease, and we are seeing cuts in that government funding. All the services that we provide to our patients in our community that are over and above the basics, you make those possible. You nourish us. Thank you for your support. Thank you for being here today. Thank you for making Northwest Kidney Centers an essential partner in the health of our community. "51 years, first dialysis program in the world, tens of thousands of people served, and an infinite number of lives that have been touched by the Northwest Kidney Centers." Let's hear from a few of them.